Good afternoon. My name is Bryant Sikorsky. I'm an independent financial planner and wealth advisor with Stratos Wealth Partners. I typically help individuals and small business owners with their financial, insurance, college savings, retirement, and retirement income planning, their investment management, including stocks, bonds, and mutual funds, and finally, supporting them and being there for them and having the answers at hand as they go through different stages of life, from marriage to birth of a child to a change of jobs, retirement, and unfortunately, if we have a death in the family. Today, I'm going to talk about a topic that's very complex and yet very much misunderstood, and sometimes very personal. It's Medicare. And it is, of all of the different government programs, I believe, one of the most misunderstood and easiest to make, unfortunately, can be permanent, expensive mistakes. So we're going to talk today about the Medicare story, how it came about, and we're going to focus on where costly mistakes can be made and help you decide the appropriate timing as it relates to Medicare. So if we start now about how Medicare became so complicated, and we can see that by looking back in time and then fast forwarding to today. So then we're going to simplify Medicare by breaking it down into 6 steps. And the decisions that you make in these steps related to enrollment timing and type of Medicare, these are very important. So we're going to go a little deeper into those steps. And then we'll briefly touch on the need for healthcare planning in retirement. And we'll wrap up with some specific actions you can take to get on the path to better decision making with regards to this somewhat complex, somewhat misunderstood topic. So if we start at the very beginning, when we looked at the first round of beneficiaries that were born in 1900, their life expectancy was just 47 years of age. By the time they enrolled in Medicare in 1965, they had lived longer than expected. And in fact, for those born in 1965, their life expectancy had risen by almost 50% to 70 years of age. And now people are expected to live to age 79 and beyond. So then came Medicare, and if you can believe it, 19 million people enrolled in Medicare in 1965. And for the first time, they had some financial stability with Medicare and Social Security. Now today, people are also working longer, and they're living longer, and they're experiencing longer time horizons, increased chronic conditions, and all around increased lifetime costs. If you talk to anyone who has dealt with Medicare, you'll get typically these relatively similar questions. Why is Medicare so confusing? Why does it have to be so complicated? And how does a normal person do this? So let's look at the factors that contribute to some of this confusion. So one factor is the population. There are 10,000 baby boomers turning age 65 every day until the year 2030. By then, when the boomers have all become eligible for Medicare, there will be 73 million people over the age of 65. And this is a far cry from the 19 million who enrolled when Medicare started in 1965. So I like to call the next contributor to Medicare complexity the mailbox collection. You will receive a lot of information about Medicare and specific plan options. It's confusing if you try to digest it all. And one of the first steps to take when approaching age 65, I would jokingly say, is to go out and go to the hardware store and get a bigger mailbox. because you're going to need it with all the Medicare mail. So enrollment and election periods, those times when someone can enroll in Medicare or elect some type of coverage, have also been a factor in Medicare's increasing complexity. You would guess there are a few, but guess again, because the Social Security Administration, if you can believe it, this agency and not Medicare is in charge of Medicare enrollment, premiums, penalties, and more. So you'd think Social Security should know what it's doing. However, Social Security has over 2,700 rules and thousands of codicils or language that modifying or explaining the rules. But they only have one phone number. So if you call Social Security and you don't get a menu of push 1 for Medicare and 2 for retirement benefits, you get the same agent in the same queue. Now, hopefully that agent will have an answer, but in too many cases, if your situation is uncommon, you may be out of luck. I remember reading all the different articles about how, the Wall Street Journal called into the IRS or Social Security or the IRS or other government agencies and asked questions, and literally half the time the answers were incorrect. With all of this to get through and understand, it's no wonder there's confusion. So what do you do, or where do you go for help? Well, some people go to a neighbor or friend. Some people go to legal or medical professionals. Some go to human resources individuals. And some go to financial professionals. So yes, Medicare got complicated, but we aren't talking about Medicare made complicated. We're talking about Medicare made simple. So let's try to simplify things a little bit. We're going to break it down into 6 steps. Oh, I love the pictures. When it comes to Medicare decisions, most learn about these 3 steps: how to choose a plan, how to enroll in Medicare, and how to enroll in specific plans. But there's an important decision around these steps that you might be missing. Timing. So should you enroll at age 65 or should you delay? 2, type of Medicare. Most often a choice of Medicare or original or Medicare Advantage, and then annual review of coverage. This 6th step may look small on the future horizon, but this is an important part of the process. Employment benefits are reviewed once a year. It's the same with Medicare. Needs in Medicare plans may change over time. So we're not going to spend time on this today, but if you've already enrolled in Medicare, at least meet kind of once a year with your financial professional to go over anything that should change. And the first steps of timing and type are important because this is where most of the permanent and very costly Medicare mistakes are made. And as we talked about before, Medicare mistakes are not to be taken lightly. In fact, just one Medicare mistake can cost a person thousands of dollars and often cannot be undone. So what are you supposed to do? Well, congratulations, you're here. And this webinar is designed to help empower you to gain at least a beginning or rudimentary knowledge you need to make the best Medicare enrollment decisions and avoid any costly permanent mistakes. So as I mentioned, timing and type are what we'll focus on today. So let's make it even simpler and concentrate exclusively on them. Timing is the first step of the Medicare process, and it's a very important one. So again, this step is about determining whether you should be enrolling in Medicare right away at age 65 or delaying Medicare enrollment. So some key factors that play into a timing decision for for an individual are Social Security benefits. Are you actually receiving benefits? If yes, delaying Medicare may not be an option. The type and quality of your current health insurance. Is it a high deductible plan? Does it have what's known as creditable drug coverage? What is your employment status? Are you actively working, or is your spouse, or are you retired? Believe it or not, how many employees work for your employer providing their health care coverage? Is it a large or a small company? Are you actively making contributions to a health savings account or HSA? If you do choose to enroll but keep secondary private coverage, you can't contribute to an HSA. Now, there are others, but these are some of the most vital. The answers to these should be carefully considered and kind of thought out before making a decision on timing. So let's take a little closer look at this. Those who are already receiving Social Security benefits by the age of 65 will be enrolled in Medicare automatically. You'll receive a Medicare card in the mail 2 or 3 months before your birthday, and you have no choice. Medicare is a condition of receiving Social Security benefits. And at a minimum, you must keep Part A hospital insurance. Part B, medical insurance, is optional coverage because it comes with a premium. The question becomes, must one keep Part B? If not, you must take action to suspend it. People who are not receiving Social Security benefits when they turn 65 must take action to enroll in Medicare, as Medicare enrollment is not automatic. So key first factor there is, if you're receiving Social Security benefits, you are already enrolled in Medicare. And if you're not, then you must take an action to enroll yourself, as it is not automatic. Now let's look at employer status. There are those approaching Medicare age who will not have coverage. For example, you're working but do not have coverage. You may have an individual plan, but will be giving that up. In these situations, you must enroll during your initial enrollment period or face consequences later. Now, for those who have coverage through an employer group health plan, either based on your employment or that of your spouse, Medicare decisions depend on the size of the company. A company with fewer than 20 employees has 2 options. 1, the company can exclude those who are turning 65, be they employees or dependents, from coverage under the group health plan. Medicare would be the only payer. Or 2, the company can continue to provide insurance. In this case, by Medicare secondary payer laws, the employer plan coverage becomes secondary to Medicare. In either situation, those turning 65 must enroll in Medicare Part A or Part B. Otherwise, you risk full financial responsibility for your care costs because you will have no primary payer. On the other hand, a company with 20 or more employees cannot change the rules when an employee or dependent turns 65. Now let's say that again. On the other hand, a company with 20 or more employees cannot change the rules when an employee or dependent turns 65. The company must offer the same benefits to all employees. They cannot change premiums, costs, or coverage for those who are Medicare eligible. In this case, enrollment in Part A is not required. Repeat that again, it's not required, but it should be considered. Part B is optional and probably not needed, but should be considered. So, with 20 plus employee company, a delay without penalty is a possibility, despite what you may hear from many people. Now let's talk about health savings accounts. Those who work past age 65 need to know about some issues that can have an impact on their Medicare status. One of the biggest is a health savings account, or commonly referred to as an HSA. So here are some important points to know. Once enrolled in Medicare, an individual can no longer contribute to an HSA. Those who have high deductible health plans with an HSA should not enroll in Social Security. That's because Medicare Part A comes right along with Social Security. Now, Social Security has a policy on retroactivity. If signing up for benefits after full retirement age, Social Security will automatically backdate the application by a period of 6 months. The enrollee will receive a nice benefit payment. However, that means the Part A effective date will be 6 months in the past, jeopardizing any HSA contributions made during that time. The backdated effective date also has an impact on lifetime earnings. Those who sign up for Social Security should specify clearly that they do not want retroactive benefits. You know that many Americans continue to work into retirement, but leaving your job after age 65 can complicate Medicare decisions. Those leaving employment may be offered other types of coverage, such as continuation of benefits, or COBRA. This is retiree coverage sponsored by the employer or a union, or a severance package of selected benefits. And because this is often the same coverage you had while employed, you may think you don't need Medicare, and that belief can lead to mistakes. By Medicare secondary payer laws, these types of coverage are secondary to Medicare. That means they pay after Medicare pays its share. To ensure there is a payer, enrollment in Medicare is a must, with a capital M. Without Medicare, there is no primary payer, and that's like having no insurance at all. Now that we understand some key timing considerations, let's look at the time periods in which people can enroll in Medicare. So as we shared earlier, there are many enrollment periods, but we're going to focus on 3 of the most common. First up, number 1, is the initial enrollment period. The initial enrollment period is that first chance most people have to enroll in Medicare. This is a 7-month period surrounding your birth month. It begins 3 months before your birth month and ends 3 months after your birth month. Then when Medicare coverage begins will vary based upon when you take action to enroll in Medicare. So late enrollment penalties can apply to Medicare Part B and Medicare Part D coverage. For Medicare Part B, 10% of the standard Part B premiums for each year of late enrollment gets added to the regular Part B premium you pay each month. So you can see in the calculation, if you did not enroll for 3 years after you should have, your monthly premium will be 30% higher, or 3 times 10%. Late enrollment penalties for Part D kick in after 2 months without creditable prescription drug coverage. Creditable means that on average, the plan pays at least as much as a standard Part D drug plan. For Part D, the penalty adds 1% of the standard Part D plan premium for each month that you did not have creditable drug coverage. Again, this penalty gets added to whatever Part D premium you currently pay. So in this example, Part D enrollment was delayed for 48 months. The result is a penalty of $15.93 per month on top of the standard monthly premium of $33.19. The penalty is added to the individual's plan premium, not to the standard premium. Now let's apply what we learned through a case study to contextualize the impact of a timing mistake. So here we have Carol. When Carol was about to turn 65, she did a lot of research and became very fearful of late enrollment and their penalties. So as soon as she turned 65, she went ahead and enrolled in Medicare Part A, Part B, and Part D. She also, now here's the key, she also kept her husband's large employer group plan, which meant that Carol's mistake was enrolling too soon for Part B and D. She was paying for duplicate coverage that she could never use to the tune of $5,200. So now plus, and even scarier, she now no longer has her guaranteed issue right to get a Medigap plan. And that's the plans that cover deductibles and copays. If she wants that type of coverage in the future, she will have to go through medical screening or underwriting, meaning the insurance company can ask her medical questions. So for Carol, who has a few chronic conditions, this was a big deal. She may never be able to get this type of coverage in her lifetime. So in summary, let's learn what we've learned so far. So these are the most common pitfalls you should seek to avoid. Okay. So I said timing considerations were important and where you can avoid these mistakes. The second step in the Medicare process is where you can make decisions related to the type of plan that is right for your unique needs. For most people, this choice will be either original Medicare with a Medigap policy or a Medicare Advantage plan. But before we examine the differences between these two plan types, let's learn a bit more about how Medicare is structured. You've probably heard that Medicare has 4 parts, A, B, C, and D. However, I think it's preferable not to really teach it this way. In our experience, people have a tendency to treat this like some kind of shopping list. I have to get an A, a B, a C, and a D, but that's not the way it works. That's not true. And the reason for that is that technically, Medicare Part C is simply a repackaging of it or a different way to get Medicare Parts A, B, and D. So I instead would prefer to teach that Medicare has 3 basic parts: Part A for hospitalization, Part B for medical insurance, and Part D for prescription drug coverage. Sounds a little less complicated already. And there are two different distinct types of Medicare, two unique ways to get the three basic parts. Let's begin by reviewing the three basic parts of Medicare. So again, Medicare Part A is hospital insurance. This part of Medicare is premium free for those that have paid Medicare taxes for 10 years or has a spouse that has done so. If you're hospitalized or in need of skilled nursing facilities or rehabilitation after a hip or knee surgery or hospice services, this is the part of Medicare that will provide you with that coverage. Now, please note that this part of Medicare does not include assisted living facilities for ongoing care needs. Part B, Medicare Part B, is medical insurance. Think of this as an outpatient component of Medicare, those services that are necessary to diagnose and treat a medical condition. That begins with doctor visits and then may include anything diagnostic from blood tests to MRIs and whatever can be done in an outpatient setting. Part B includes many preventative services. The most common are flu and pneumonia vaccines, mammograms, pelvic and prostate exams. I guess you are prostate when you're doing your prostate exam, and colonoscopies. This technically is optional coverage because it comes with a premium everyone must pay. And for 2020, the monthly premium is $144.60. However, failing to enroll when one should leads to late employment penalties that we've already covered. Part D is prescription drug, D for drug coverage. This is coverage provided and administered by a private insurance company, not the US government. There are between 20 and 30 plans available to most beneficiaries. This coverage helps to cover the cost of medications based upon a plan's drug formulary. A drug formulary is essentially a list of the medications that a plan will cover and how it covers them. In most cases, you will share in the cost of medications through deductibles, co-pays, or co-insurances. And remember, Part D plans do not cover over-the-counter medications, vitamins, or any type of supplements. Now that we've discussed the basic parts of Medicare, let's talk about the two distinct types of Medicare. Most people, when they turn age 65, have two choices or two options: original Medicare or Medicare Advantage. Some people may have additional options such as retiree coverage or military coverage, but for today's sessions, we'll address just these two main types. First, let's talk about original Medicare. This Medicare is administered by the US government. When you choose this plan type, you can see any provider who accepts Medicare regardless of location. There are no networks like we think of maybe today. When you visit the doctor, you'll pull out your Medicare card, and that's how you are identified. This Medicare is administered by the US government, and it starts with a person enrolling in Part A and Part B. Now, technically, I guess you could stop right there and say, hey, I'm enrolled in Medicare, and yes, technically that's true. However, A and B by themselves can become very expensive. In fact, Part A has a $1,408 hospitalization deductible. Notice that I said hospitalization, not annual deductible. Part B has a 20% coinsurance on all healthcare services. Every time someone sees a doctor or specialist or has an outpatient procedure, 20% of the bill will be their responsibility to pay. and Parts A and B by themselves have no out-of-pocket spending limit. That's why if comprehensive coverage is needed, a Medigap policy and a Part D prescription drug plan will need to be added, both of which are provided by private insurance companies. Once the monthly premiums are paid for a Medigap plan, most if not all of the out-of-pocket costs associated with Parts A and B just simply go away. So you can see how important this is. So let's talk a bit more about what a Medigap policy is. A Medigap policy is the same thing as Medicare supplemental insurance. This is insurance administered by private insurance companies. These policies cover those things that Medicare Parts A and B do not, such as the $1,408 hospitalization deductible under Part A, or the 20% coinsurance for health care services under Part B. With this coverage, you get a Medigap policy with no questions asked. You must have what's known as a guaranteed issue right. Medigap policies are standardized by the federal government into 10 different plans known by letters such as Plan C or Plan F. Any plan, regardless of provider, must provide the same basic plan benefits. However, if you're in Massachusetts, Minnesota, or Wisconsin, these states have their own state-specific standardizations. They do not use Plan F or Plan G. So what is a guaranteed issue right? This is a rule that essentially ensures that a person can obtain a Medigap policy with no medical screening or underwriting, which means the insurance company cannot, quote, ask medical questions. With a guaranteed issue right, insurance companies cannot deny an individual a policy or raise premiums based upon their medical history. Someone has a guaranteed issue right to get a Medigap policy for the first 6 months that they are 65 years of age or older and enrolled in Medicare Part B for the first time. Once both of these are true, a clock starts ticking on the 6-month period to get a Medigap policy. Oops, I skipped a slide here, excuse me. After this 6-month period, insurance companies can ask medical questions. If they find anything they do not like, they can raise premiums or deny coverage. So let's talk about the other main type of Medicare. This is known as Medicare Advantage. First, you'll notice that instead of government building icon, we put a corporate building here because this is Medicare administered by a private insurance company rather than the government. The insurance company is in charge. They get to make the rules. And when visiting the doctor, you'll have to show your insurance card, not a Medicare card. So a Medicare Advantage plan must provide basic Part A and B services, but they can change the rules that you must follow in order to get these services. And more on that in just a minute. These plans usually include Part B drug coverage as well. Then to make this plan as attractive as possible, these plans usually have low or no monthly premiums. And this is a huge selling point of Medicare Advantage. Plus, they can add elements of dental, vision, and hearing coverage that original Medicare typically does not include. The insurance company then mixes all these things together into a package of coverage known as an MAPD plan. And Medicare refers to Medicare Advantage as Part C. But you can see it is really just a different way to get the three basic parts of Medicare. Now here's the rules that an individual seeking Medicare Advantage must follow. You must see providers in a network. Remember, under traditional or original Medicare, that is not an issue. If you go outside the network, you may be completely on your own paying the bill. And it's important to remember that legally, these provider networks can change at any time. You are also subject to prior authorization rules with this type of plan, meaning if the doctor says, hey, it looks like you need to get some surgery on that knee, before that surgery can be scheduled, the insurance company must agree that they think you need that surgery and that they are willing to pay for it. Otherwise, people are on their own paying for that service. Prior authorization rules typically come into play for services like home care, surgery, physical therapy, and seeing specialists. But prior authorization may come into play for more and more services as time goes on. There can be services that do not require prior authorization. And each time healthcare services are used with a Medicare Advantage plan, you will be responsible for paying these deductibles, co-payments, and co-insurances up to that plan's out-of-pocket spending limit, which can change each year. So the path of Medicare Advantage is essentially the opposite of original Medicare. Premiums are low or zero, but then you'll have to pay every time you use healthcare services. You could spend up to the plan's out-of-pocket maximum. And if for whatever reason the rules of the insurance company are not followed, you may be responsible for paying the full cost of any health care services utilized. Now, this is why I've said several times that people get stuck. In 46 states, as soon as the type of Medicare is selected and a person heads towards enrollment, you basically have to imagine that an earthquake happens behind them. Now, if you want to change paths, types of coverage, you'll have to wait for a bridge. But bridges only come and show up at certain times of the year, and in order to cross, you may have to follow the rules of the bridge. Now, it's pretty easy to switch from original Medicare to Medicare Advantage. As long as it's done at the right time of the year, Medicare Advantage plans have to take people regardless of any pre-existing medical conditions. The problem comes if you want to switch from Medicare Advantage over to original Medicare. In most states, you are no longer have your guaranteed issue right, that guaranteed ability to get a Medigap plan. This means that if you want to switch types of coverage, the insurance companies can ask medical questions. If the insurance company finds anything they don't like, they can charge more for coverage or deny coverage altogether. Without a Medigap policy, you are once again subject to all the deductibles, co-pays, and co-insurance inherent in parts A and B by themselves with no spending limit. So this is why people get stuck, because essentially, if you cannot get a Medigap policy, switching to original Medicare could be a major financial strain. So let's look at a case study one more time to apply what we've learned so far and why choosing the right type of plan and why it can be so problematic if you misstep. So we're going to cover Roy's Medicare type mistake. When Roy enrolled in Medicare, he chose a $0 premium advantage plan. 2 years later, Roy developed a chronic condition that requires regular and sometimes extensive medical care. As a result, he now faces many out-of-pocket costs that are adding up fast. He would like to switch to original Medicare with a Medigap policy so that he can pay a monthly premium and then have no out-of-pocket costs. But Roy no longer has guaranteed issue right. With his pre-existing medical conditions, he's been denied coverage by 3 different carriers and is very unlikely to find one that will offer him a policy. Essentially, because he didn't understand the implications of this decision, he now faces thousands more in out-of-pocket costs. He is limited to in-network doctors and must receive prior authorization before using certain healthcare services. So in summary, here's a short list of pitfalls to avoid. And let's review those one more time just for, okay. So we think about these pitfalls. Assuming zero premium means free. Out-of-pocket expenses and copays can be considerable. Not thinking through the consideration and rules of each Medicare type. Making the same Medicare decisions as a friend or spouse. Believing that you can switch from Medicare Advantage to original Medicare with a Medigap policy at any time. So we did it. We got through the 6 steps in the Medicare process and went a little deeper on key timing and type considerations that can help people avoid costly, often permanent mistakes. So now you are prepared to make a good Medicare decision. I also just want to take one or two slides here just to think about healthcare costs and retirement. And this is important to think about and discuss with your financial advisor so that you have a plan to cover these unexpected and some expected and sometimes unexpected costs. So when it comes to healthcare costs and retirement, 6 in 10 people age 50 plus say they are terrified of how healthcare costs may derail their retirement plans. 73% of these people say that one of the top retirement concerns in healthcare costs going out of control. In spite of these fears and concern, more than 80% of retirement plans don't consider healthcare costs and needs. And less than 15% of people can name someone they would trust to help them with these needs. So there's never been a time to start thinking about an income plan for these expenses. And I say that because when I talk to people about retirement, they have a tendency to think about, oh, well, and I'm being maybe a little bit extreme here, is, well, we will only have one car. Won't go out to eat, or one of us won't go out to eat like we did when we're working. So they think that, okay, when I'm working, I'm going to spend $70,000 a year. And when I retire, I'm only going to spend $30,000 a year. And that's just not the case. Sure, you might buy a couple less sandwiches and you might have only one car, but I can tell you from working with clients that that healthcare costs quickly fill in those blanks. So let's look at what those expenses could look like in retirement. According to an analyst of the Bureau of Labor Statistics, Medicare households spend a whopping 40% more on healthcare than non-Medicare households. A 65-year-old couple could need up to $285,000 for healthcare expenses in retirement, and that doesn't include long-term care, which could cost $22,000 to $80,000 a year. It may come as a surprise that Medicare premiums are not the same for everyone. If you have a higher income, you could pay more for Part B medical and Part D drug coverage if they are subject to the income-related monthly adjustment amount surcharge, better known as IRMA. This monthly surcharge is based on a 2-year look back at IRS reported modified adjusted gross income plus any tax exempt interest. Even with complicated Medicare rules and all the various healthcare expenses, some of which we touched on today, I want to assure you that there are things you can do to prepare for healthcare costs in retirement, and not to be fearful that they might eat away at your savings later in life. Even with complicated, and so I've got an example here, excuse me, giving you an idea of how you can address those costs. So if you think about income sources in retirement, you're probably planning on Social Security and IRAs, 401ks, and personal savings. Maybe you even have a pension plan. Some of these income sources create a reliable stream of income, or stated another way, they're guaranteed. But some are not guaranteed to last forever, like your personal savings sources. Notice there is another category here in green, which you may be less familiar with. This is known as an annuity, and an annuity with a lifetime income benefit is similar to Social Security or a pension, or an annuity with an income benefit can also provide income for life. So regardless of the sources that comprise your income in retirement, converting more income to a guaranteed category will fundamentally increase your retirement confidence. Why? Well, because the more income someone can guarantee, the less likely a sudden cost or change in their health will impact their long-term ability to fund retirement. So if you have questions about this, be sure to talk to your financial advisor. So we've covered a lot. Let's summarize here and say that to meet with your financial professional, if you're in the Medicare decision process, ask questions like, if you're 55 to 64, what steps can I take for income and accumulation planning for future health care expenses? If you're turning 64, what key considerations affect my personal situation, and what do I need to appropriately plan for? When is my initial enrollment period, or do I wait for a specialized enrollment period? Or if you're over 65, when can we meet to review my annual coverage needs and what I might want to consider changing for next year? We made it. That's it, the end. I want to say thank you for joining me. Again, my name is Bryant Sikorsky. I'm an independent financial planner and wealth advisor with Stratos Wealth Partners. I know this was a lot to cover. I know it can be overwhelming. So, like I said, make sure you seek out your financial advisor to ask questions. If you don't have a financial advisor, or if you'd like me to review these with you, this is my website. You can see I'm located here in Cedar Grove, just north of Hillsborough. This is my homepage. And I have recorded this webinar, and I will upload it to my YouTube channel probably tomorrow. So I'll stop my recording here.